about, oh, hello, kind family, and welcome to another edition of the Boob. Dominique and I were just getting ready. We are so excited to be here with you tonight to talk about all things breastfeeding and feeding your babies and parenthood. Just like every week, we love being here with you. Just quickly want to remind you about our free starter pack offer that gets you everything you need to get started with Kind. You're going to get your adapter that you need for your pump, a twist pouch to try, and the twist squeeze bottle with a nipple that just pops right on to the pouch. So you have direct pumping and also direct feeding if you like. If you find that your baby is not a fan of this nipple, or you already have a nipple that you like, you can also use the system with another nipple using one of our adapters. So be sure to use the link that's going there across the screen, or send us a DM or a message. We'll make sure that you get your free starter pack today. And we're just going to jump right into your questions and get answering. So don't be afraid. Don't be afraid, and don't forget to continue to comment, to share, to tell your friends about the live show tonight. And at the end of the show, we will pick somebody to win a twist gift set that's been engaging. So share away. We're going to start with this first question. This says, do all of the milk producing tonics and things that are around nowadays actually work? Or are they just a waste of money? Cat's got my tongue. I will start with just a little kind of thought, and then I'll hand it over to Dominique for a little bit more of the science behind it. What we know basically is that some of these products do work for some women. There's no the research is still really new on them. So there's no official evidence that says this one ingredient works for every single mom in every single situation. But we do see that, when you're working with your lactation professional, there may be something that they suggest that you do. So you should always go by their recommendation if you're thinking about taking anything.
Yeah. I will just say, there's no magic, no magic pill, no magic powder. Breastfeeding supply and demand. So, you have to increase that demand on your body to kind of produce more milk. Like Aaron said, some things have been shown to work, some things have been shown not to work. I generally tell mothers, if it's going to work, it's going to work. And if it's not, it's not. And you just have to, if you want to try and spend the money, you just got to figure out, if it's going to work for you. At the end of the day, it's not medication. Most of these things are just herbs. That's it. It's just things that grow naturally in the ground. So if it's going to do something, it will. If it's not, it's not. And you just have to see what works for you.
Yeah, that's what I, will get a lot of questions about, like the cookies. And I'm like, you know what? I like cookies. So if you want to try a cookie, by all means, it's likely not going to damage, anything. Right. It's a cookie.
The only bad side about a cookie, it's got a lot of sugar in it.
Well, right. You just have to be just like any cookie.
It's not bad, but it's bad.
It's just easy to have a lot of them, right? But yeah, so just kind of go into it with the expectation that it may not work. It may or it may not work. And your lactation professional should know your situation well enough to know if something is way out in left field or something like that for you. If you don't have a lactation professional, you can always send us an email. Dominique can ask you some more questions and kind of get a feel for what's going on and see if there's any particular things that she recommends. So lc@kind.com. You can email us anytime. If you forget the email, you can always send us a message on Facebook or Instagram. We'll make sure it gets to the right place. But lc@kind.com. This question says, what's the best advice for feeding in the hospital? Should I strictly breast or try to pump while I'm there for a few days with my scheduled C-section? So I did want to just give Dominique a quick plug for our blog post last week. If you haven't visited our blog, Kind EDU, please do. You can find it on our website. Dominique actually wrote a really nice article all about what to expect when you're having a C-section with breastfeeding. So that's a really great thing to read, but I'll let her share some of her advice.
So usually, just treat your C-section like you had a vaginal delivery. Put your baby skin to skin as soon as you can, and then nurse early and often. Work with a lactation consultant. If she feels like you need to start pumping right away, then I would start pumping right away. But if there's no need, then just nurse your baby on demand. If this is your very first C-section experience, I will say that a lot of times C-section babies are very sleepy and very spitty and very gaggy. So a lot of times those things can get in the way of the breastfeeding. They may not want to do it right away. So just don't be discouraged and keep trying. If your hospital will let you do skin to skin in the OR, ask for it. Maybe ask for it now so that it can be planned in advance. But ask for skin to skin in the OR so that your baby can attempt latching while they're kind of sewing you up. But if they do not allow that, then I would just, do skin to skin as soon as possible after your delivery. But in most cases, if you just nurse on demand and keep baby close to you, everything should work out okay.
Yeah, I think that's really great advice. And like Dominique said, work with your lactation professional for some of the challenges that any birth may
That's right.
bring to you. There's all sorts of things that happen in birth, interventions and things like that can be frustrating. So work with your professional. This question is, what's your advice for pumping while trying to conceive? I think
Don't. um, I mean, because if you're trying to conceive, then you would need to be, you need ovulation, right? And most times when you are breastfeeding and pumping, inducing lactation, your ovulation is suppressed. So if you are trying to actively have a baby, you don't want to also be actively doing something that is designed to suppress your ovulation. Obviously, some women do get pregnant while they're breastfeeding, and some women do start their cycle in the middle of breastfeeding. But in most cases, most women do experience the suppression of their ovulation cycle while breastfeeding. So if you're having trouble having babies and you really want to conceive, I would not start pumping at this time. That's just my advice, but you can call your lactation professional and see what they think as well.
Yeah, I think the most important thing is just to be aware of what Dominique said, that breastfeeding, pumping, breastfeeding can delay ovulation. So it may take longer to conceive. If you're
Yeah.
feeding your baby and that's the way that you're doing that, of course, you may need to continue pumping. Just have that expectation that conceiving or getting pregnant may be more difficult or may take a little bit longer than to
Right.
say if you weren't. Now, if correct me if I'm wrong, Dominique, but if your cycle has returned, you may have a little more luck.
Right.
Um,
Yeah. If your cycle has returned on its own, then yeah, then that's fine. You just do whatever you've been doing. But if you're like I'm maybe I'm thinking of the question wrong because I'm thinking of somebody who is having trouble conceiving and they want to, but they're still pumping. So if you're already having difficulties, you don't need something else to further give you more complications. I guess if that makes sense.
right.
Maybe I'm reading the
Yes.
question wrong. But if you're already nursing, then continue nursing. If your cycle has come back, then yes, that does increase your chances greatly. But if it hasn't and you're trying to conceive, then the pumping and nursing will not help in that because it suppresses lactation.
Right. Yes. I
Or
think those
not,
are
sorry,
both good.
ovulation, not lactation.
Yeah. No. Yeah. I got you. I think those are. It's all good to know. This next
Yes,
question
ma'am.
is, do I have to feed on both sides every time?
I always suggest it. It gives your baby two opportunities to eat. It doubles your supply, um, and it also helps with other things like your baby's cognitive development and their eye development and their muscle development on both sides of their face, stuff like that. Obviously, there are some women that choose to only nurse on one side and that's it, and it won't hurt you or anything. However, if both are producing, why not use both of them, especially in the very beginning?
Right. And you may find that your baby does not accept the other side every time, but it's always a good practice to offer.
Yeah,
Um,
always
to
offer.
give them the opportunity. And if they are a one side feeder, be sure to alternate to give them like Dominique was talking about, that muscle movement on both sides and things like that. This next question says, looking to decrease from 4 pumps a day to 3 pumps a day. What is the best way to do this without getting clogged ducts or mastitis?
I usually suggest to wean down the pump you no longer want very slowly. So if you're pumping for, say, like 20 minutes, I would just do maybe like 5-minute increments and shave it off. And once you get to the last 5 minutes, then drop it completely and hand express to comfort. And I usually say shave off 5 minutes like once every 3 to 4 days. If you have like an oversupply, then I would say wait a week. So that your body really gets that signal to kind of slow down.
All right, slow and steady. And obviously you'll know if you shave off 5 minutes and you're really uncomfortable, you may need to shave off 2 minutes at a time. You'll
Right,
kind of have to see
exactly.
how your body responds. But slow and steady is always the best practice if you can do that. This next question, this is a good one. I experienced this as a mother. Any tips for a 7-month-old who refuses to take milk from any source but boobs? She will starve herself and refuse to take milk all day when I am away, up to 12 hours sometimes. So my daughter was just like this.
I had one of those.
She was not even into toddlerhood. Once she was, eating solids regularly and taking a sippy cup, she would drink almost anything out of a sippy cup except breast milk. Like, she would drink water. She would drink, after a year, she would drink other milk. She would drink a smoothie, but she would not take breast milk anywhere but from me.
Because she knows it comes out of boobs.
Well, and even if I was gone, so something that I learned, and I'll let Dominique talk a little bit more about kind of the details of this, is that what my baby would do is she would reverse, what they call reverse cycle. So she would have her nighttime or her overnight during the day as far as feeding goes. So like some babies stretch 12 hours overnight and sleep all night. My daughter would, if I was gone, she would do this long stretch of not nursing, and then it would be like every 2 to 3 hours when we were together.
Yeah. that's
yeah. So I mean,
right.
it was tiring, but she was still like, I only say that to be reassuring that she wasn't like hungry or starving, because she was doing a naturally long stretch, right? Like babies generally start to do a long stretch.
Right.
She was just not doing it at a common time.
Right. Yeah. And that's exactly right. She's probably reverse cycling. My middle girl did the same thing, but I will say she was my spicy child from conception, but she never took a bottle. She was drinking milk out of a sippy cup at like 4 months. And then once we hit 6 months, she was like, no, milk comes from boobs. I'm not, so she would, I would be pumping, 15 ounces a day at work. I'm gone for 12 hours. And if she drank anything, it would be like 5 ounces. That's it. But she would just nurse while we were together. She'd nurse overnight. As soon as I got home, the nursing fest started. And yeah, like Erin said, it is exhausting. But, your 7-month-old doesn't have the wherewithal to starve herself. Like, she doesn't have the mental capacity. So if she is hungry or thirsty, she will ask to eat something. She will ask to drink something. She won't, she's not like an adult where it's like, if I don't want to eat, I can just tell myself not to eat. She doesn't have that mental capacity. So I wouldn't worry unless she's not reverse cycling and eating overnight, or if she starts falling down in her growth curve, like if she's losing weight or not gaining as quickly as she was, or gaining at a normal rate, then I'd be worried. But if she's healthy otherwise, making her diapers and growing fine, I honestly wouldn't worry about it too much. These little guys know what they're doing. Some kids love boobs, and they know the milk comes out the boobs, and they don't want the boob milk out of any other source but the boob. And I mean, that's totally fine, because it kind of takes some of the pressure off of you pumping while you're away too.
Yeah, and I would do my best, like, to get milk in her while I was away. Like at 7 months old, my daughter was eating solids fairly well, so like I would maybe make her some oatmeal that we could mix milk into, or something, so that if, say, like my husband or her grandma or the babysitter or whatever had something like, so she didn't feel like she didn't have any resources, right,
Right. Yeah.
for soothing or whatever.
Yeah.
I would always leave a cup of milk or a bottle of milk in hopes that, she would drink it.
Uh-uh.
Sometimes she was willing to do an open cup. So there's a lot of different things that you can try, but like Dominique said, overall, as long as, you know, all the boxes are checked that tells you she's getting what she needs, you can maybe kind of take a deep breath
Hmm.
um, from that and just kind of work with her being patient.
But if you're
This next
worried,
question
like,
says,
oh, sorry.
no, you're
Oh,
ahead. Go ahead.
I was just gonna say, if you're overly worried, just like you said, Aaron, hide it and stuff. Make a
Yeah.
smoothie, but instead of using water or like almond milk, use your milk. Make some soft foods with it, like purees, like vegetables or apples or something like that. And instead of using water, use your milk. Do the oatmeal with your milk. Those are things you can do if you're overly worried. But I think baby will be okay. Sorry.
No, you're okay. This next question says, my 3-month-old is exclusively breastfed, but I want to introduce a bottle sometime. What's a good way and time to start that?
So I usually say there's a sweet spot between 2 and 4 weeks to introduce a bottle. Usually after a month, those are adult babies and they're set in their ways. And sometimes they're not very accepting of new things. So I think your best plan of action with an adult baby at 3 months old is to have someone else give the bottle, and then you leave um, the room and let them kind of figure it out and sort it out. And also maybe just I don't be upset if the baby doesn't complete the full feed with the bottle. Like maybe she only drinks like 15 mLs or 30 mLs or something like that, and then you finish the rest of the feeding at the breast. That's totally fine. And then baby steps to work up to that. But I think that may be the best route is if you just stay out of it and let somebody else do it. Because I think if you try to give the bottle at this point, you and baby are going to be fighting because that baby knows that milk comes out of the boobs.
Yeah, and I
Why
mean,
are you
you
giving
never
me
like
this?
it's good to have expectations of all scenarios because your baby may surprise you and be like, oh, no big deal, right? Like milk is
Right.
milk. They may, like Dominique said, take kind of play with it or take a little bit and need some practice, or they may be like that last baby we just talked about, like, no way, Jose,
That's right.
I'm
I
not
know where the
taking it.
milk
So
comes from.
just have expectations that it could go any way, and it's okay to ease into it, and it's okay to, you may have to try different nipples, you may have to try different people, different scenarios.
Right.
Just be patient with it because it's a whole new experience. This question says, any tips on how to go about pumping in between feeding twins? First
Yeah.
time mom, they will be here in a few short months and I'm freaking out about milk supply. Thank you.
Uh, well, I would say this. Get with your lactation consultant, whether they're at the hospital or if you have a private one, and talk to them because twins need a feeding plan. And with that feeding plan, the lactation consultant will tell you when to pump. So normally, depending on how strong your twins are, how early they are, may depend on what they do. They may not, if they're going to be pretty young, they may not even be able to go to the breast, and you may just be only pumping. So I wouldn't worry about so much what to do. In general terms, I would just get your specific situation, talk to your lactation consultant, and then depending on when you have your baby, kind of go back over it so that you can get a specific feeding plan. Because twins in the beginning, there's some work. It can be done, but there's some work, and so I think a specific feeding plan would be best than me giving you a bunch of generalizations because I don't know what kind of babies you're going to have here, but congrats and good luck.
Yeah, I mean, the only other thing I'd add to that is your body knows that you're having twins.
Right.
So, as like Dominique said, sometimes twins can be born preterm or late preterm, and that can add some added challenges, which can be the same for a singleton, right? That's born
Right.
preterm.
Exactly.
But as your milk supply gets going, whether it's stimulated by your babies, it's stimulated by the pump, it's a mixture of both, your body knows, hey, I'm feeding two babies. So
Right.
it's more about just doing what you need to, like Dominique said, work with your lactation professional to talk about how the stimulation will happen for you, but your body will still know what to do.
Exactly.
Um, this question says, I feel like I constantly leak. No shirt is safe. I even leak through pads. Any advice so I can start to wear shirts with color again?
No, you just have
That
to
is
walk
such a
around with your
relatable, like,
boobs out.
I don't know about you, Dominique, but I was like a major leaker.
Yeah.
I found what worked for me, and this is just really a personal, anecdote, is that I would double up my washable nursing pads. So
That's a good
I would
idea.
use like a thinner one and an overnight one or whatever. It gave me some extra bulk. I'm not gonna lie, but at least I wasn't wet all the time. And I really only did it if like I had to go somewhere. If I was at home, I was just kind of like, whatever, it'll dry. But and I would do the same thing at night. Sometimes at night I would even use a disposable nursing pad or even a like a pre-fold cloth diaper underneath me or something like that to catch
That's
the
actually a
leaks
great
because I was
idea.
just a
Cloth
leaky
diapers
lady.
are very absorbent. I would say I never leaked. Ever, 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 ever. Three babies nursed for years and years and years and never, 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 never. I think I had one incident where I wouldn't even call it leaking because I knew I was full. I knew I needed to pump, but I was running my mouth and I was standing like this putting pressure on full boob, so of course like milk came out, but I think if I didn't do that nothing would happen. So I don't have personal experience with that, but yeah, I tell moms, there's a company that makes little silicone cups that you can put in your bra to catch all the leaky milk, so it catches it, you can save it, and it doesn't get on
Yes.
your shirt. The only downside is you can't bend over.
Right.
So you just
There
got to
actually
remember.
is, I think, one brand, you may have to do a little bit of research here, but I think there is one brand that's like more of a circle than the teardrop that
Ah,
um you can't like totally bend over, but you can move as normal
yeah, yeah,
person.
yeah. So you can look into that. Cloth diapers are very absorbent. So even if you yourself aren't cloth diapering, now I have not cloth diapered somebody in 2 years, so things have, or actually 3 years, so things have changed. But I think I got some pretty good pre-folds at Walmart and Target, and you can put those in your bra too. Those are very absorbent. Bamboo cloth diapers, I mean, excuse me, cloth diapers, cloth uh, pads are super absorbent. They're more absorbent than the regular ones. So if you can get a hold of some bamboo ones, you can kind of double up on those. Excuse me, those are absorbent. And then maybe kind of be mindful of your pumping schedule or your nursing schedule. Usually, when you're leaking, it's because your body is saying it's time for something to happen, and it's just not happening as fast as what your body feels it needs to. So, if you know that, your worst leak times are, maybe 12 o'clock, maybe at like 11:50, maybe start getting going before that happens. Um, I don't know.
Yeah, I mean,
I
it's just kind of one of those things. Like we could give you ideas all day of how to like
yeah,
protect your
yeah,
shirts and stuff. You just kind of have to find trial and error what works for you. This
exactly.
question from Ashley says, I am exclusively pumping and has since she was born, as she wouldn't latch. My supply has stopped increasing with her needs. I'm having a hard time adding in formula. What's the best way to get her to drink formula? She seems to hate it.
Uh, um, I would say maybe look at the type of formula you're using. I've never tasted formula, but I've smelt it, and some of it smells terrible. So, I mean, if it smells like that, I can't imagine anyone trying to consume that. So maybe see what kind. If your pediatrician's okay with it, maybe try a different kind. Um, of formula. Maybe I would. I hate to say mix it with the breast milk because that can be so wasteful, but it maybe try it like a small amount. Make the formula as it says on the container, and then pour a little bit of breast milk in there and see if she'll take it too. But don't do too much because if she doesn't take it, then you got to throw everything away. You can't save it. It has to follow formula storage guidelines. Or you maybe try somebody else to give it to her and you not give it to her. So that way she can associate the formula with somebody else and the breast milk with you, and then maybe she'll be okay with that. Also, too, maybe look into paste bottle feeding because if she's taking, more than typical amounts, then she's probably being overfed a little bit. So maybe your supply is fine, but she's just being overfed. So it kind of looks like you're not making enough, when in fact you are. She's just eating too much. So maybe start doing some paste bottle feeding and see if that can slow her down a little bit. And then maybe talk to a lactation consultant, or you can email me at lc@kind.com and tell me like some things that you're doing, and we could kind of troubleshoot to see if there's some ways we can get your supply back up again.
Yeah, that was what I was going to suggest after what you said is we know that formula and breast milk don't taste the same, unfortunately. So no
Yeah.
matter what you do, it's hard to trick them.
Yeah, they
But I
know.
think, yeah, I think Dominique and I have both seen many situations where families felt like the breast milk wasn't enough and it was really something else going on. Maybe too
Hmm.
small of a flange size or too big. We need some hands-on pumping, slow down the feedings a little bit, do smaller feedings more frequently. There's lots of
Right.
different things that can be underlying if you're not feeling comfortable with adding formula in or how that's going. That's not to say that supplementing with formula is a bad thing. It's a great thing and sometimes it's necessary, but you can always look at the underlying just to make sure before
Yeah.
you put yourself and your baby into what feels like a really uncomfortable situation.
Right.
All right, we have time for one last question. This question from Kimberly says, second time mom, should I expect a larger milk supply this time around? That's a very good question.
Well, there's lots of studies out there that say the more babies you have, the more milk you make up to a certain age. Um,
Interesting.
but and usually that's if you were successful with breastfeeding and you induce lactation for a long period of time. So say your first baby you nursed for 6 months or more, that holds more true for those moms than if you just only nurse for like a week or a month or something like that. So it's kind of, and it, the way I understood it was it kind of works like labor. So when you have your first baby, your labor is long and more painful and slow, But when you have your second baby, that labor is shorter, and then your third just kind of flies out of there. So it's like because your body knows what to do, so it does it well, it does it more efficiently every single time. And then anecdotally with me, also too, your milk may come in faster too. So with me, my first took 4 days, the second took 3 days, the third took 12 hours. So 12 hours after he was born, my full milk was in. He was not happy, but it was there. and and I noticed with him too that just like my middle girl, which I wasn't able to do with my first, I was able to pump like 15, 20 ounces a day that I was at work, and I was only at work for 10, 12 hours. So I felt like that was a lot of milk, which compared to my
Yeah.
first, I was lucky if I can get 10 to 12.
I mean, I think like, something that I found to be true as just as a personal experience as a mom of two is that like Dominique said, we know the studies tell us within um, labor and breastfeeding and stuff that we have really good muscle memory. Our
That's
body
right.
remembers that it's done that before, and so like your milk ducts, you've used them before, and so they're going to remember like, oh, this is what it's like to be filled up and used. So I think that I had a similar experience to Dominique that with my second, my milk transitioned a lot more quickly and a lot less alarmingly. Like with my first,
Mm-hmm.
I went like from day 3 of drops of colostrum to day 5, I woke up with boulders on my chest.
Yes.
Whereas with my second, like day 3, my baby was satisfied. Day 4, I could start to hear her really swallowing. Day 5, she had those really seedy poops, but I never felt like, here's my milk.
Right.
Like it
Yes.
just kind of was a little more like my body just was like, this is what we do. This is how
Yep.
we feed a baby. I happen to have oversupply with both my babies. I don't know that that's anything specific to 2 babies, but I would say, as I say with everything in parenting, don't have any expectations, because you never know what will happen. But we do know that science tells us that our bodies do remember.
That's right.
What's going on. So those are some really awesome questions tonight. You guys always surprise me with the awesome questions that you have that get me thinking. I don't know about Dominique, but thank you so much for being here with us tonight. The winner of our gift set tonight is Leslie Fredrickson. So Leslie, send us an email to support@kiinde.com to claim your gift set. Just a quick reminder, I know we've plugged it the whole time, but you can email Dominique at lc@kiinde.com if you have questions. Please join our support group. We have our support group, Kind Community. It's a peer support group, Lactation Consultant led here on Facebook. Dominique's in there. I'm in there. If you're already in there, you know Lauren. She really does a great job at helping us moderate that group.
Congratulations on your new baby, Lauren, if you're watching.
Yes, Lauren did have a baby just a few weeks ago. So if you're really looking for somebody who's in the thick of it with you, she's
poor Lauren.
Yeah, she's right in there with you. So thank you again so much for coming and spending some time with us tonight. We know that you guys are busy and you could be spending your time all sorts of places. We are so grateful that you choose to be with us, and we'll see you again next time.
Bye.
Bye.